Drug resistant TB is a TB where the bacteria is resistant to first line drugs. As I mentioned, to INH and rifampicin, these are the first line drugs. If the bacilli is whatever the bacteria, Mycobacterium tuberculosis is resistant to INH and rifampicin, it is called as drug resistant TB, that is multi drug resistant TB. Mono drug resistant TB is also there for INH. And XDR-TB is what I mean to say is for second line drugs. Second line drugs is whatever the drugs we are giving for multi-drug resistant tuberculosis, like levofloxacin, linezolid, and bedaquiline. Any of this plus plus any of the first group A drugs. That is, one is fluoroquinolone, that is INH and rifampicin, and fluoroquinolone. This is pre-XDR. XDR is INH, rifampicin, fluoroquinolone, or bedaquiline or linezolid. This is called XDR-TB. The most common cause is the bacteria always after certain mutations. What happens? There is always a chance that natural mutation. But for INH, it is 1 in 10 to the power of 6. For rifampicin, 1 in 10 to the power of 8. So, one bacilli to become a drug resistance, at least 10 to the power of 14 is required, but it is a very rare chances. The most common cause for drug resistance is we are responsible for that. We have created an environment for the bacteria to resist to develop a drug resistance. It may be a poor quality of the drugs, or it may be non-availability of the drugs, or it may be wrong dosages or wrong combinations, unsupervised treatment, absence of guidelines, non-compliance, or health system is not monitoring the treatment, or there is a poor funded or poor adherence, or there may be a chance that the patient might be taking the right drugs also, but absorption is less, and there is a social stigma where the patients are not ready to go and take the consume the drugs in front of others, so there is a chances of default. So it is one is a doctor's cause, another is a patient cause. Both are responsible, and programmatic cause is also responsible. But the chances of cure among drug resistance is only up to the 50 to 60% only. Whatever we do that, because more adverse effects will be there, long duration of treatment. That is the reason the best. This one is prevent drug resistance by consuming the drug 6 months, right dosages, right standard treatment, and right follow-ups.